Hello and welcome to another conversation. We are following up with Dr. Niroshan Sivathasan after 7 years. So let's go into the interview and see what he had been doing all of these 7 years, following from our previous interview, and also going to discuss interesting aspects across the spectrum of medicine, but also into AI. Welcome to the show.
Thank you. Rajkumar, I thought it was 10 years, but it's perhaps reflective of me aging. 7 years. Wow.
7 years, yes.
And there's been a lot of change. And we did have some light-hearted banter initially, asking whether this should be in Tamil or English. But given some of the serious aspects, we thought English would be the right way forwards.
Well, we could actually throw in some of the dialogues in between that that could actually make things interesting.
Yes.
But let's just kick off. 7 years seems awful lot of time, right? Because a lot of things has happened. But for some, wouldn't be the same. So
Yes.
Tell me about it. Like at the time when we were talking initially, you were in the transition of moving to Australia.
I had already moved, actually. It's been 12 years.
12 years, right, okay.
It does feel like a lifetime. And as you said, when we were growing up, change occurs over a 10 to 20 year period. Change now, as per your article, I think you mentioned your writing, is on a 3 to 5 year.
Even less, right? Because what actually fascinates me is that I have seen or studied about industrial revolution, or even, the whole agriculture, which however started like domestication of animals to hunter-gatherers transferring into an agricultural society. Those took like thousands of years.
Absolutely.
And industrial age is about at least 100 or 150 years or more, right? But the information age was about like 1970s to 2000. But the AI age
which we're in right now. So, of course, as you said, the first industrial revolution was mechanization.
Yep.
The second was electrification. The third was digitization. Now we're in the midst of the fourth industrial revolution, artificial intelligence.
And as you can actually appreciate, after COVID, roughly, we had about, thousands of AI, especially the generative AI, is just taking over the world, right? And we could actually kickstart with your kind of experience in medical field, that how the change in those 7 years, what changes are you seeing, and how have you actually placed yourself when you were setting it up? Because you studied here, audience who have watched your interview before, they'll understand all about where you qualified and worked, and you practice in many countries. So how are you settling in Australia and how are you doing?
Okay, well, as you've intimated, trained here, and also in France, New York and Los Angeles or Beverly Hills. And then now I'm in Australia. What have I done over the last few years? Well, I was a key opinion leader for a number of pharmaceutical companies to do with energy-based devices such as lasers, cosmetic injectables. I was an international trainer, so I was getting flown around a lot, especially in the pre-COVID era. And since then, I've also acquired a number of medical licenses for countries around the world. There are some bigger plans at play, which I'm sure we'll touch upon later on. I launched the world first clinic, which had cosmetic medicine, cosmetic surgery, dentistry, beauty, and lasers inside a hospital. Unfortunately, the timing was just before the Australian bushfires from a few years ago in 2019. And then, of course, early 2020 was COVID. So timing couldn't have been worse, but that is life. And you learn to both be flexible, or the favorite word that everyone says, to pivot as per the challenges, and to modulate and move on. And as they say, as long as you're always learning and growing, that's the key thing. I've also gotten into medical legal work. Australia, interestingly, is now the most litigious, which I couldn't believe. It used to be in the early noughties, so about 25 years ago, fairly high. I think second to California. Then they introduced changes which restricted it. But now it's actually, I think it's overtaken New York and California. So that's something else we can talk about. And of course, that's partially to do with the plague that was also in the UK, ambulance chasing no-win, no-fee lawyers. Lawyers are being pumped out left, right and centre, and therefore they need a job. And there are unfortunately certain mechanisms you can do to get silly payouts. But anyway, that's something we can talk about. And then, of course, in recent years, all the COVID shenanigans,
Yeah, before we're getting into COVID, I would like to ask that to get to this point, especially establishing this far into the medical field,
Yes.
and especially a very, very niche area of cosmetic
Yes.
surgeries, and controversial as well, right?
Yes.
We did actually talk about reconstructive and also aesthetic ones. Now, you would have passed through so much pain,
Yes.
so much challenges.
Yes.
Because can you share some of that? Because and going back and
Yes.
seeing what kind of pains that you or the challenges that you had to face.
With pleasure. So when I trained in the UK and in the States, I'd always envisioned becoming a burns surgeon, head and neck cancer reconstruction. Moving to Australia, you're outside of the system. Essentially, you're starting from scratch. To go from having everything, including my own private practice here, to all of a sudden having nothing and doing fellowships. And when you do a fellowship, there is a lot of sacrifice, both temporal, financial, and emotional. And then you start to accelerate from there. So actually, my niche is penile augmentation. Did I ever think that I would be augmenting or assisting men with their private parts when I was in medical school? Absolutely not. But I suppose that's the journey of life. Sometimes you just never know. And of course, tummy tucks, facelifts, and I'm a recognised expert in injectables. So things like botulinum toxin or wrinkle relaxers, fillers, and I also am involved with an academy here called Harley Academy, which I was supporting from its outset, I think about 8 years now. And that's grown incredibly well. The market here, of course, is very different from Australia, but even compared to France and Germany, it's a very deregulated, or how can I put it? There's a lack of harmony in this market here. It's a very different one.
So it works in silos or kind of in isolation, rather than a coherent.
So far, it's been poorly regulated,
right?
And it's been actually viewed very negatively by a lot of countries.
So that would have affected your plans and journey. But specifically, if you want to mention something that you have to come across, like a very specific one, what would that be?
In terms of my challenges or trials and tribulations?
And then the pain that you had to pass through. Because
yes. I suppose the key thing here would be, and upon reflection, you really learn to understand jealousy is all around us. And especially in Australia compared to the UK, there's a lack of camaraderie. The regulator there is extraordinary and has a very bad reputation. The GMC, in contrast, of course, when we're here, we all complain, but it's very reasonable compared to the regulator there, which is dysfunctional at best. There are a lot of groups there that are trying to make changes, because suicide amongst healthcare professionals, Australia is exceptionally high, not just for physicians, but nurses, physios, paramedics across the board, because it's a very punitive system. So there's that challenge, particularly when you work in a very elective area, cosmetic practice, where you're not dealing with the burden of disease or disfigurement, and therefore expectations are different. But in addition to that, you learn that, of course, not everyone has their heart in the right place.
Mm-hmm. And then the psychological challenges will be quite high, isn't it? Because as you said, this is not something that you're not treating a patient for some serious illnesses, but also they have actually chose to go to kind of for aesthetic reasons or maybe medical reasons.
Yes.
But within yourself, because how you've been brought up in childhood and also all the challenges, I'm pretty sure something would resonate and something that always comes back. So have you had this like kind of couple of talks within yourself, internal and external, that debate about what you're doing and what you want to do? So I'm very interested to find out that kind of a mental, psychological kind of pain.
I think the word here is psychology.
Yeah.
Both for the person providing the treatment and the person receiving it. As the person providing it or the provider, you have to make sure that you have correctly counselled the patient, you've understood them. That requires a degree of empathy. you've got to make sure that you're able to meet their needs. So compared to other areas of medicine, there is a risk of expectation delivery mismatch. So the psychological aspect is significant. There's of course the ethical consideration as well with what's being done. Are you adding to people's perhaps body dysmorphia or negative viewing of themselves? You've got to make sure that you dance around that appropriately as well. You've got to make sure that you are being financially reasonable as well, both in terms of ensuring that they can afford what they wish to have without being in debt down the track. They're aware of what it entails. And of course, medicine by its very definition is unpredictable and complications may result. So if you're not on the same wavelength with the patient, it does lead to issues down the track. And the Royal College of Surgeons of England, in their cosmetic masterclass, actually have a wonderful statistic. 50% of patients decide that they're going to sue their surgeon upon the first meeting within a couple of minutes, which is an extraordinary number. Now, there could be a lot of reasons for that, but what I counsel my mentees and people that I've trained and taught in some way is that if you are not comfortable as well, have a low threshold to get a second opinion or to even guide the patient to see someone else. And that is perhaps the biggest pearl of advice I would give to anyone who is wishing to have a significant percentage of their clinical practice in aesthetics.
So in terms of patient care and all of that, have you, let me phrase it in a different way. Have you regretted for any of the decisions later? The reason I'm asking this question is that it'll be helpful for other professionals coming out, especially young professionals. So you don't have to go into details, but if you could say, have you regretted on anything and how you would do differently?
Yes. So firstly, the number of physicians who are performing injectables, forget the surgical aspect, that's going up. So a lot of GPs do this for a number of reasons, of course. And I think any experienced doctor that says that they do not regret in their private practice at some point taking on a patient is either dishonest or they've had a very small private practice or they're forgetful, conveniently forgetful. There are multiple occasions where you go to do the right thing and then you realise you've bitten off more than you can chew, not just technically. Forget that, that's more of a surgical issue at times. It's more to do with the patient and their demands and expectations. Patients can manipulate as well. So yes, you get rogue doctors, but statistically, as a percentage, you're going to get a lot more, how can I put it, disingenuous or perhaps even dishonest patients. And that was an issue here in the UK more than Australia for a number of years.
And especially in this field, they're healthy people, they're coming in for a surgery, right? So the more chances of they could actually be unhappier.
Yeah, after. Correct. Because they have a certain psychology or way of thinking. But even simple things on a practical basis, such as in this country for a number of years, patients were going in, getting the treatment, and then saying, oh, I've left my handbag in the car, I'll be back in a second, and then running. Without realising they've had their photos taken pre-treatment and they've had driver's licenses or whatever taken. I suppose the sad thing for this country, one of the things that I found has really gone downhill is I think the judicial system is failing the average person. I don't think it's fit for purpose in many ways. And the police just don't respond to these things anymore. I mean, this sounds controversial, of course, but I would suggest that the police are not going after the big things such as burglaries and so on. They're choosing to perhaps go after other less important things, which as society would classify. There are lots of reasons for that, and I am generalising, of course, but I suppose these are additional considerations as a business owner, because now you're not just a physician or surgeon. So in addition to being a professional, you're now a business person too. And that entails understanding marketing, it entails human resources, so many other things. So I think you have to be willing to, sometimes there's a baptism of fire, as they say, so.
It's quite a long area and kind of exploration, but if you were to just say in a couple of lines to somebody who is actually aspiring to be someone like you, what they could do differently, specifically that if you can actually say what to avoid and what to go for in very short.
In a very punctuated fashion, 3 things. Number 1, ensure your training is up to scratch, because not only are you doing justice to the patient, it will also protect you down the track should there be an issue. Number 2, always act with ethics. Again, you've got to sleep with a good peaceful mind and a clean conscience. And then number 3, always have people in the industry that you're able to turn to, whether it's a second opinion or help, guidance and so on. Nobody knows everything. And I think a lot of people are unconsciously incompetent. They don't know what they don't know. And certainly in this industry, a lot of people, especially when they're junior, they like to beat their chests, say that they are the best at this, best at that. And all too often, they have a lot of schooling that they need to undergo, shall we say. So those would be my 3 top things.
That's a very interesting point you touched at the end, because in the new generation, commitment is something that never been seen, right? And they want instant gratification on things. So, on the time that you were studying for long hours and long commitments and planning, and that's something with the invent of AI and all the other things is just disappearing.
It's a brilliant topic. There were many months where I only slept 5 or 6 nights per week, not 7, because there was a drive for publishing and so on. And yes, I have a 27-page CV. You can ask yourself, what's the benefit of that? It does round you in a different way, but as a principle, I agree. Gen Z is not viewed favourably by most of the world. I even heard a statistic earlier on, whilst driving in, that 70% of the British population negatively view Gen Z or Z. And there are, of course, lots of reasons for that. And I agree. I think it's a combination of entitlement, lack of focus, lack of diligence, lack of sacrifice. And AI is going to change things even more, because the value of knowledge or the acquisition of knowledge is going to, by definition, go down. AI, artificial intelligence, and particularly AGI, general intelligence, or ASI, super intelligence, is going to change that. So what I'm now telling people is invest in your body, and perhaps I can take a little bit of advice myself, but invest in your body, coordination, fitness, and so on. Number 1. Number 2, understand principles, because if you have principles, you can apply it to situations.
And values.
And values. Yep. There is no substitute for that. And your EQ is more important now than ever before. And all too often, a lot of people lack good EQ. That's not to mean that you have to cower down and find excuses for people, but it means that you'll be able to interact. But you've got to have that limit within yourself as well. When to say enough rubbish or enough BS, I'm just going to cut it. But EQ nonetheless is an invaluable skill, or quality rather.
What I could actually see from all of this is that, so many years ago, or like I think it's 100 years ago, when Rockefeller said that this is how the education system is going to be.
Yes.
And that's coming into play now, because pretty much large population, it's not actually going in the line of thinkers. But just followers, or just following the trend. You know where I'm referring to.
Absolutely correct. And a lot of the audience may be unaware of what was instituted in the past. And I think you're on point. Always be a thinker and not a sheep. And even the last few years, and that's something I'd love to explore with you, that's a passion and an interest of mine that I've been working on with various groups in Australia, including representing in the federal parliament over there. I think critical thinking, there is no substitute.
That's true, absolutely. We can go on about it, but we want to move on. So myself was tempted to move to Australia.
Yes.
I have my half family there, so I have actually thought of it. But what you're, and also I heard like from medical industry, a lot of people wanted to go there from NHS. The state of NHS is another discussion that we can go into. But what you're saying is quite worrying. You said about the suicide rates, and also saying the camaraderie, or like some kind of, and also one of the points you mentioned is that it's very important, surround yourself with support network, and I think that's actually missing. So what went wrong, and why I hear something different? The other health professional who sees the grass is green on the other side.
And that's a human trait, or it's a human problem, I suppose. You always see things differently. But experience teaches you to be more objective. And I've worked in Perth, Brisbane, Canberra, Melbourne, Sydney. I've got a great grasp of Australia. I've lectured around the country, Cairns, etc., etc. So I feel that I can, when I say something, I have a very considered opinion, and I'm also involved in various representative groups. There is no doubt the quality of life in Australia far surpasses the quality of life here. In so many ways and on so many levels. Safety, as I've already intimated, lack of traffic, cleanliness, and so on and so forth.
Outdoor activities.
Outdoor activities, it's unmatched. The houses are, of course, larger as well, and the overall way you live is better. The country does wake up much earlier as well, and by the time it's 6 a.m, there's a nice beat going on in the country. Now, from a medical perspective, I think certainly that's something I have a lot of experience with. There are a lot more nuances. Number one, a lot of people go there because of the push factors from the NHS primarily, and also because of the pull factors, quality of life. And yes, you can earn more money, but I've also seen a lot of doctors, including Tamil doctors, come back. Now, one of the key reasons for that is Australia is so far away, and when you have your own family, you realise...
And the extended family.
The value of extended family is significant. So if you are blessed and have grown up there with lots of family there, fabulous. The other issue in Australia, it's very authoritarian. And especially during the COVID era, countries like Canada, which, to be honest, was diabolical and disgraceful, what they did, and that's something I'm very happy to talk about, although perhaps this is not the audience right now. Australia was up there as well. In comparison, a lot of European countries were fairer. And I think that has also led to a change in the mindset, not just of Tamils who are living in Australia, so Australian Tamils, but also Australians who have other ethnic backgrounds as well. And sometimes, as we said earlier, you get these paradigm shifts in society, and certain trigger points or trigger events open eyes. And I think that was one of the big things. And I think Victoria, particularly in Australia, received a lot of negative coverage, and rightly so, because of its very coercive nature and very almost jackboot on your neck approach with the police that lost a lot of support. So I think, of course, in life you have to decide what values you have and what you're willing to compromise on and what you're seeking. And I think having, and again, I've worked in other parts of the world and have other medical licenses. There are wonderful aspects to Australia for sure. The medical side, however, has changed. Even in the last 10 to 12 years, it's changed, and adversely so. And that's something for young Tamil doctors who are thinking about moving
So
over
can you
there.
give some instances what actually drives doctors to an extreme point of suicide?
Well, so not just physicians are over there, but one of the big issues is the lack of accountability of the regulator, the heavy-handed approach of the regulator. There are so many other nuances that are driven. There's the two aspects, the Medical Board of Australia and AHPRA, so the Australian Health Practitioner Regulatory Agency. And whereas here it's a lot more uniform and streamlined, there it's all over the place. And I know a lot of lawyers who work in this field, and it's staggering, some of the stories I've heard about how disjointed things are. That has caused strife for a lot of doctors. And remember, if you're unable to work for whatever reason, your whole life falls apart.
Yeah. Especially if your license has been cancelled.
Your license, and that's something that any regulated professional has to be aware of. And in California is another issue as well right now, by the way. And interestingly, in California, it's not doctors who are at the top of the Californian Medical Board, it's lawyers, which makes you wonder what competence a lawyer has to deal with some of the nuances and situations in a medical environment. And I think part of that is because doctors generally, there's no real leadership. There's a lack of doctors who are willing to stand up. And I've always said it takes good men to do nothing for evil to prevail. And eventually, everyone takes the path of least resistance, standards do drop, and everyone ends up paying. So I think, again, as with everything, multifactorial, but there are some systemic changes that need to happen.
What that would be?
I think we'd probably run out of talk time.
But just to say, like, what fundamentally you like to
around
see.
the world, I can tell you what I would do if I were structuring things. Number one, encourage the best and brightest of the medical cohort, pay them well so that they take an interest in the regulatory side of things. Bureaucracy generally, is self-sustaining in many ways. Governments are guilty of that. Government's always expanding, and really we should be shrinking governments to improve efficiency, to stop wastage of money. But partially, the very best don't want to be doing this, because if you can have a good private practice or you can do something else, why would you want to be doing mundane, bureaucratic, administrative, repetitive things? So I would change the, pull factors for people to enter. There should be structured training programs, arguably, as well, where doctors who are showing this kind of interest can go into that. But I would also counsel people and say, after a number of years, you become very detached from the reality of being, on the wards, seeing patients on the coalface, as they say. So if you're fully in this role, I think after a while, you also become very separated from your colleagues and peers who are actually dealing with the challenges. So I think it's good to have a hybrid role in many ways.
Definitely. So before we move on from Australia, I personally experienced, or at least had a chat with a lot of GPs or general practitioners. There's quite a deep-rooted racism problem within the patients that in choosing who they wanted to see as a doctor, because as you say, there's a large ethnic minority or doctors from different countries.
Yes.
So, and in Australia, the system is such that you can choose which GP you want to go and see.
Yes.
And that actually playing a big part in terms of who I want to see and so on.
Yes.
So do you think that's kind of comparatively to UK and Australia, is it a serious problem or is it just isolated incidents?
Very, very good question. Firstly, Australia is a nation of immigrants by definition. So, and I think a lot of people forget that, number one. Number two, patients ultimately want to see the best of the best. So if you are the best, they will see you. Now, that's not to say that they're not prejudiced or biased. We all are in some ways. And that is certainly something to be aware of. Growing up in the UK, I suffered with a lot of racism in the 80s and 90s, both, even if you're in your private car or on a bus, all sorts of things. And yes, it's certainly not as much of an issue these days, and I can feel the difference even now versus 10 years ago in 2014. There's a change in the mindset and tolerance in the UK. Australia, you could perhaps say they're a lot more blunt and just say things. And sometimes it's also the way we receive it and how we react or respond is perhaps the better word. And I have to say, in 12 years of being there, I've only ever had it once where they said, someone said, they crossed the road in front of me in a very expensive car, and there's probably some jealousy involved there. They said, that's not the way to drive here, mate, at which point I did get down and I told him off. But that was exceptionally isolated. And again, I've travelled around the country and so on. I personally haven't felt it. That's not to say that it doesn't exist, it certainly does. But I think people are sticking with a stereotype that it's more racist there.
I think this comes back to the same point as the jealousy, right?
Yes.
Aspects of it as well. Anyway, let's move on from there. Now you have played a leadership role, and especially in medicine as well as legal work in regards to medicine, and also you're known for controversies.
Yes.
So I want to go into a controversial topic because still the effects of COVID is still on.
Yes.
And not just the medical or like clinical effects, but also psychological effects.
Yes.
and overall economical effects, which we are all suffering from.
And will be for generations.
Exactly. So you have openly criticized the way that's been handled
Yes.
by many of the advanced nations, or I would rather say economically advanced nations. So would you like to share for our audience, because we still are not sure what is the way would be. So I'll leave it to you in the field of medicine that to share that with us.
So I'll preface this by saying that the way to dethrone people or an opinion is to attach an emotive label, such as a conspiracy theorist, which was a CIA propagated term from the 60s, to then discredit them. Now, you mentioned earlier, I'm known for my controversial opinions. I would say no. I'm known for having an opinion, which is better than having no opinion, because if you have no opinion, you stand for nothing. And sadly, that reflects a lot of doctors more than I feel comfortable about. And there can be a lot of reasons for that. So I'd say that as my first point. My second point, some of the very best people, I have an IQ of 138, there are people who make me look very average. They all got cancelled. They got cancelled for speaking out as a physician should. There were not just physicians, lots of people in associated fields. And yes, everybody has an opinion, just like everybody has the proverbial, I'll just say like everyone has a mouth. And not all opinions are the same. They carry different weights based on competence. And what I found in COVID, everyone became an overnight expert in immunology, biochemistry, virology, clinical medicine, pulmonology.
Because everyone was at home, nothing else to do, just front of a camera and on social media.
Correct.
Right?
But what a lot of people were failing to do, have your opinion, no problem, but exercise critique, exercise a considered judgment and a very logical approach. And that wasn't happening. So I'll tell you the things that have been shown in hindsight, although many of us were stating this from the outset. Lockdowns don't work. The numbers that were used to justify lockdowns were based on extrapolations from very questionable professors. And certainly the UK has copped a lot of grief, and rightly so, for relying on certain things. There were double standards across the world, applied in different fields and arenas, shall we say. And that is just unacceptable. The interventions that were pushed were baseless in many ways. There have been a number of associated adverse sequelae or consequences. Doctors forgot basic tenets related to consent, Helsinki Protocol, Nuremberg, Declaration of Human Rights, all of that stuff. They forgot about basic tenets related to immunology, biochemistry, and they were essentially puppets for the pharma complex. And sadly, money talks in this world, and unfortunately money allows influence, and a lot of doctors forgot about patient-focused care, and I would say they forgot about having a spine and doing the right thing. So my big issue here is that appropriate consent was not gained from patients. Patients were told, especially the mRNA jabs, where there's been nothing really in its favour, and all the papers coming out are extraordinarily damaging towards that technology, including the inventor of it and a number of others who were intimately involved, were critical from the outset, and they all got cancelled. LinkedIn, social media and so on, unbelievable. And of course, we kind of know why that happened.
So this is very specifically, we're talking about the jabs.
The jabs.
Because I just wanted to bring it out to highlight that specific aspect.
Yes. But as a principle, what we were told was not evidence-based or validated or logic-driven. And that is a big issue. You can't say something is safe and effective and make guarantees.
And especially within a very short period of time.
Most things take 5 years to bring to market. What was introduced was a genetic therapy. The definition of vaccine was altered in a very controlled and coordinated fashion. And people don't realise this, that technology had not been deployed in large populations. The data that was presented had a lot of blind spots, shall we say, and people turned blind eyes as well. And no doctor could rightly have said that it was safe and effective and made the promises they did. Now, you could argue allopathic medicine or Western medicine no one's taught about virology in vaccines. Yeah, for sure. There's no doubt about that. And a lot of very eminent surgeons and physicians around the world, including many in this country, UK, have spoken out about this. But what particularly disappoints me was that any patient that raised questions was slapped down. And what disappoints me is that doctors were just refusing to listen to different viewpoints. And I've always said, listen to different viewpoints, considered viewpoints, not some idiot talking rubbish. But when you've got bona fide experts like the most published cardiologist in the world raising concerns, I think it's our duty, particularly when we have a role of responsibility and care, to be cognizant of that. And the word cognizant, a lot of people suffer with cognitive dissonance. In other words, they could not come to terms with what was actually going on because they had preset ideas or expectations. That's still continuing. And that's not just for this issue, that's for a lot of issues. And that's why I think it's important to break things down to basic principles, and then you can build things up from that. Certainly, there's something called the Bradford Hill criteria. Some of the audience may wish to do an internet search for that. And it talks about causation and association. Let's just say there are patterns happening right now with sickness such as strokes, massive clots, heart issues, cancers, and so on. And there's a wonderful professor here, Angus Dalgleish from St George's. He's coined the term turbo cancer along with a couple of Canadian physicians and surgeons as well. They're all massively on the rise, infertility and so on. So a number of doctors, and I'm not proffering an opinion here, but a number of doctors around the world have suggested that this technology needs to be halted. There has to be a moratorium whilst additional research is undertaken. But the problem is, on this bandwagon, a lot of governments have agreed with certain pharmaceutical companies to have factories that are producing interventions or vaccines based on this new technology, and they're well advanced. Contracts worth hundreds of millions of dollars.
Sometimes it's billions of dollars.
Correct.
Right?
I'm being arguably very conservative. And it's hard to now derail that because of the sums of money. And money, power, change the direction of
Because this
humanity.
brings us to a very interesting debate, because normally if there is going to be a transition for this kind of an impact, for example, a gene therapy,
Yes.
especially when you kind of deployed in large scale across.
Unprecedented scale.
And what about the ethical arguments? Have we ever had the public debate? Because once that's been rolled out in one aspect, now there's going to be many.
Yes.
And I'm quite worried about that the neural links and all of that's going to have this kind of straightaway approvals from FDA or other
Correct.
bodies. So that isn't it worrying because about the ethical side of these things when you go into gene therapies?
Absolutely correct. And very importantly, any adverse sequelae or consequences will be seen many years down the track, by which point you would have changed the direction of humanity. And even deploying it in children, I think, is at the present time questionable at best. And I don't think there's been enough research or consideration internationally before these changes have been instituted. Disappointing.
Quite disappointing. And so in the side, I think you also talked about the jabs, but also there are research or there are evidence emerging about the way patients was treated,
Yes.
especially
Yes,
on ventilators.
I'm not an anaesthetist, but I've read the research and I've spoken to a lot of people who have superb competence in the field, and certainly some of the drugs that were utilised, some of the drugs that were told not to be used, some of the drugs that were suddenly removed off the market, some of the other interventions are, and I'll be very gentle, questionable at best. And even there was something called the Great Barrington Declaration. A professor here at Oxford and two professors in the States, I know two of the three personally, and they were, a lot of people were trying to speak out, but even when they had tens of thousands of doctors and other learned professionals supporting it, suppressed. And that when you suppress dialogue, you are heading for disaster. And free speech is binary. It can never be qualified because then it's not free by definition. It's a 0 or a 1. And what has happened? Suppression, big problem.
So that we have gone into some serious leadership related aspects. Before we complete this conversation,
Yes.
I would like to talk about more from your own experience and field, and especially you're providing a lot of leadership in this field. So before we go into the details,
Yes.
how important leadership is, and especially for other doctors. So that's something I want to ask, and then I will go into your field very specifically on some questions. So, because I don't see many doctors, especially from a Tamil background,
Yes.
providing leadership. Why is that?
I think there certainly are doctors who are doing it, but leadership has a very different skill set. To be a good leader is not the same as being a good doctor. And I feel that, of course, when you're a leader, you have to make a judgment call. You have to have an opinion. And of course, as we've intimated, having an opinion which may be against trends, against the grain, against expectation, whether it's expectation by public or from the public or authorities, that can put you in a very precarious position. So I think that's one of the reasons a lot of people just want to have a smooth life and not to rock the boat. So that could partially be it. The other thing, of course, is medicine, by its very nature, likes to have people that are fairly, how can I put it? They're replicas with a lot of their approach. And leadership requires a certain form of thinking and a way of doing things that will be against what a lot of your peers are doing. And certainly in medicine, if there were to be a problem, you get judged according to the opinion and the actions of your peers. That could put you in a point of hot water. And so I think that those are some of the many reasons why perhaps people are not out there.
So that actually leads into this question. It can apply to you, but also in general. So have you set the ambition to become a doctor in a very early age by yourself, or is it something that's set by the society or your parents, and then you work towards that?
Yes.
Because this is kind of a fundamental shift in there, because that's what's going to decide whether you're passionate to become the authority and to lead.
Yes.
So there's two different. So which one would you say for you
Brilliant
was the
question,
case,
yeah.
but also generally what you see with the others?
Well, coming from a medical family, and aunts, uncles.
So you've been pushed as well up
so
to some
there's
extent.
always that, and also culturally, Indian families, Jewish families, Chinese families, you like the professions, medicine, law, dentistry, etc., etc. So there's always going to be that, and that's a logical decision as well, because it gives you a higher chance of a certain outcome and a certain standard of living, shall we say? Although that's
stability.
Stability.
Yeah.
That's changing, of course. And you could argue that in terms of stability, you have stability if you have options, and you have options if you have money. So again, society is changing here. But in terms of my personal thing, yes, I always wanted to do that. And whether it was from a young age looking at my father, or whether it was something that I was naturally drawn to, there's probably a mix of both. But certainly, the family influence is strong. But since becoming a doctor, I enjoy being on stage. I enjoy sharing my ideas. I'm not scared to speak out. I like a microphone, and like you, I'm a fairly confident orator. So those skills and interests naturally led me into some of the things that I'm doing, whether it's with Parliament or whether it's teaching.
Would you say that's true? Would you say that's true to most of your colleagues who studied or who are with you in the field of profession?
That's not true for most people, but then there are other skills that people have. Patience could be a good example, especially psychiatry. I don't have those qualities, you could argue, or certainly I don't have those interests. It's perhaps a better thing. So I think everyone adds things in a very different way. And this is what makes a society. You can't just have the same type of people doing the same thing. Otherwise, you don't have evolution, growth, development, and cohesion. So we all add in different ways, and providing we all embrace logic and good ethics and fairness, I think that's the way things proceed and progress.
Okay, let's go specific to your field. So inevitably, there would have been some form of pressure and suppression, or however you would say, because
Yes.
when you actually mentioned earlier, before this conversation started, that your family and especially your other half wanted you to be a target, because when you put
didn't
the head,
want me to be a target.
yeah,
yes.
when you put the head above the parapet, and
Absolutely.
that's kind of suppressing your kind of what you want to do, because
Yes.
you like to get out there, make clear your opinion, and so on.
Yes.
So that would have been a real challenge. How did you break that, and how did you come out of it?
Well, I've always believed in the pursuit of justice and the pursuit of knowledge. And I would not be myself if I didn't have the strength, fortitude, inner belief to give a considered comment or have a position. And as I mentioned earlier, I don't want to be a sheep. That's not to say you have to necessarily stand out adversely, but I think it's important to have opinions, particularly where you have a responsible role. And yes, it does come with compromises, sacrifices, and potential targets on your back. But that's normal as you ascend both as a professional and as you develop internally. So whilst there might be expectations, and we have to make that judgment call. If I do this, what's going to happen? So pros and cons, almost like a SWOT analysis. And I think after a while you become very effective at doing that very quickly. You don't necessarily have to think about it, but also it depends on your principles and values. And I've always found that if you don't call things out, things just go downhill. And I remember...
It's easy to say that, but coming out of that, it's not going to be straightforward, right?
Correct. And one of the first times I had that was when I was a fellow in maxillofacial surgery at one of London's top teaching hospitals. And there was a lack of logic that was applied. There was... one of the big issues with the NHS, thanks to the Tony Blair era, and some of the bizarre changes that happened during that time, was the whopping growth in managers who mostly don't achieve much. You could cut them by at least 50 to 75% and have the same outcome. Similar to, and I'll give you an example, Twitter or X. When Elon Musk went in, got rid of so many people, whether it's because he's deployed AI or whatever it is, a lot of inefficiencies were removed and it functioned pretty damn well. And it's the same thing. And these people then have to find a reason to sustain their job and to justify their role. So they come up with a lot of nonsense. And I remember speaking out about it, and the consultant to whom I was answerable actually told me privately, well done and thank you for doing that. And it's that kind of thing. I think we owe it to ourselves and to our colleagues, peers, to voice concerns.
So can I actually draw those examples that you mentioned, that the positive feedbacks or some kind of encouragement help you to liberate yourself or break from that kind of paradigm?
I think that works for everyone. Positivity and good feedback or positive feedback, it's a loop. However, even without such comments, it's concordant with who I am as a person, and I would therefore have been doing the same anyway.
So have you got the realization very early in your life or late?
Fairly early in my life, but also inevitably you attract friends of a certain caliber and a certain nature. And as I mentioned earlier, one of the tricks or one of the arts in life is to surround yourself with good people who are genuine. And I listen to their feedback too, and their counsel, and warnings too. If you do this, this may happen, etc., etc. But by and large, I'm surrounded by people of that similar mindset.
So moving on from that, because about opinions and these suppressions, and especially thinkers, the current generation, it's very much, we mentioned this, we talked about this, the following mindset and kind of being like a sheep, and especially of what's been said in the in the industry as such, I would say all the good things, only the good things and fancy, interesting things are shown on the social media, not the sad parts.
Yes.
So when it comes to your field specifically for corrective therapies or specifically aesthetic therapies, plastic surgeries, why do you think, especially young men and women coming for these corrective therapies, is it specifically to fulfill that the projection or what is being cool or what is being nice, like you can talk about the fuller figure to zero size and changing on all of that, or do you think that they're coming in because they feel, because this is also hormones, right, within themselves, and then all the feel-good factors and so on. So is either, are they doing it for the outer world, which is being artificial, or do you think they're doing it for themselves?
You've raised a number of good points, and there's a lot to unpack here. Multiple comments. So, number one, to do with age, one has to have a certain degree of maturity and understanding, and arguably physical evolution and development as well. So, for example, if you take breast augmentation, that's why doing it on an 18-year-old is suboptimal. The breasts continue to develop through to about 21, and therefore it's better to wait and to exercise a more conservative judgment call. But also, unfortunately, social media expectations are driving younger and younger people to feel that they have to do something. But it's easy just to blame social media. And yes, there are people dancing and doing all sorts of weird and wonderful things on there. But prior to digital social media, there were magazines. Girls are looking at magazines, teenage magazines, and even ones aimed at young women. So there were expectations that were also pushed there without the moving and the dancing and all of that stuff. And that's been going on for many, many decades. It's not new. In the 1600s, women had a certain shape. That was the norm, that was the expectation. It's changed over the centuries. And culturally, there are differences too. What one expects in France as aesthetic ideals is very different from what you would see in, say, Nigeria. So one of the things, I suppose, is as a provider to make sure that the patient understands what they want. And one of the considerations is it permanent or is it a temporary thing? And when they're young, I think it's important to say no. The problem, of course, is when doctors or other healthcare professionals try to say no or put their foot down. Also, in this age of social media, straight away patients go, well, I'm going to leave a bad review, or I'm going to go and complain to the regulator. And they don't get very far, and people are now aware that there's rubbish flying around and so on. However, it's still grief and disappointment. So it's similar to antibiotics and GPs. If a GP tries to do the right thing and be a custodian towards careful use of antibiotics, a lot of patients go in demanding sick notes and antibiotics and so on. That puts them in a difficult position. So it's a very hard thing to try and find a solution for, but that's certainly one of the challenges. In terms of social media, by and large, I think the area of the population that's most affected is the young population, and too many of them are.
And you might have a lot of young people as patients. So in them, have you actually seen? I mean, obviously, talking to them, because the pre-surgery process and all, you would have found out their intentions, why they're doing it. Yes. So that's why I'm trying to get at, and what is the major cause?
Absolutely. So some people naturally, where they may not have developed in the way that they would like, you could always say, yeah, I understand it. Other girls may come in with large lips. They want even larger lips. This kind of whole thing there, the fake, weird look. And I think it's important to say no. Or certainly, you've got to not treat them straight away. My population generally for surgery tends to be more middle-aged. Right. But injectables is more of a young person's game. And that's also because the outcomes you can get are better with people who are younger. The skin is tighter, the bone has not resorbed or shrunk, and so on and so forth. So you can, I suppose, get more bang for your buck in some ways. without surgery.
This can go on and we can actually discuss a lot, but I wanted to go into a very important aspect that you are also part of an AI revolution and you are part of a company invest heavily in B2B AI.
Yes.
So let's talk about that, because what actually made you, I mean, obviously everyone's interested in AI, and
Yes.
especially with the generative AI and neural links, what Elon Musk is trying to bring in.
Correct. Transhumanism.
Exactly, because I always tell my students that there will be at some point I won't be there to do your lectures. The whole thing that I have to do will be transferred through neural links, and you just pay for the service and then just walk away. It could happen. That could be really a challenge at some point for
Correct.
human intelligence and all of that we're talking about, and the IQ and so on. But then explain a bit more about your work and how you've been interested into AI and so on.
This is, again, a huge area. Essentially, we're in the midst of the fourth revolution, industrial revolution. AI is here, and it's here to stay. And you can either embrace it and utilize it to improve your quality of life, to improve your efficiency, or you can shun it and find that you may run the risk of it replacing you in some way. Now, they also talk about the separation of AI into a good AI, into a bad AI, who should have access to some of the abilities and technologies, should there be governments restricting it?
But that's going to be in any technology, right?
Correct.
The same with internet when it was actually initially.
Yes.
Even now, up to some extent, there are some regulation and some openness, but that's going to be in the AI field as well.
Absolutely, but I would suggest that what AI can achieve will be far more profound than a lot of what we've seen in recent years. And in terms of what got me into it, I was quite lucky. I had the opportunity to become part of an American startup, and I've got a very large network, a lot of connections, and we are now in partnership with a company called SingularityNet, or Zaka, and many would suggest that its founder is the father of modern artificial intelligence. So it's a challenge that I wanted to grab. It's something different, and it's the future. So in a nutshell, those are the things that were driving me to do it. But also the things that can drop out in terms of technologies and so on, not just medical, not just companions for people or triage systems or that kind of thing. We're talking things that may improve email productivity, co-pilots. We're talking about systems in hotels. Literally, the list is endless. And there's a lot of creativity here as well. And it also means that I'm learning new things as well, mixing with a different cohort of people, software engineers, people who are involved with the technical sides of the hardware, that kind of thing. But the way I see it, I want to embrace it, and I want to utilize it for the future.
And specifically, because this is a wide area that your company or your startup is covering, so, without going into NDAs or anything, can you say very specifically what you think that you can achieve in a very short period of time, and specifically if it's in the field of medicine or general?
I've already intimated a couple of things, and you've also hit on precisely some of the restrictions with NDAs and so on. But there's a lot of things being developed in the pipeline, and one of the things, of course, is not just having generative text, predetermined generative text, or generative predetermined text, GPTs, but it's actually having freelance speech-to-speech, so that you're almost interacting with a person that's able to think and respond semi-autonomously and soon autonomously. And that's where we're going. And that is both a threat or a challenge to certain industries, but also it will revolutionize and create new industries as well. So as with so many things through the course of human life and evolution, there are going to be paradigm shifts, and they are coming very soon.
And everyone else should embrace this in such a way, because I see that within my students still they have this attitude towards it. Yeah, this is because they haven't seen the changes in the past.
Yes.
And just to show or share some interesting aspect that I was doing last night, because before this interview, I had the option to watch my previous interview, but then I thought, let
I
me
need
get
to do that actually. Yeah.
yeah, but let me just get the transcript of this.
Yes.
So with an AI,
Oh, wow.
I got the whole transcript of it
Yes.
and summarized with important points.
So you even summarized it for
yeah,
you.
it summarizes and also to tell me where I agreed with you and where there was slight contradictions.
Okay.
So all the whole analysis of it, which was quite useful for me to prepare the following questions.
If you think about how quickly it can do things, and I suppose there's the ethical side of things, and I was having a debate yesterday with an incredibly intelligent chap, and he was saying AI is more prejudiced. And of course, AI is the outcome of the data it's fed, and humans, by definition, have biases and prejudices, and therefore you could argue it's there. But you can also inculcate it with values that will try to minimize it. So I don't think it's more prejudiced than humans, and I would strongly suggest that if it's developed appropriately, they talk about the beatitudes of Jesus Christ, Krishna, charitable values from Islam, etc., etc. If you can feed all of that into its development, it's almost like a child.
Yeah.
Then you can change the direction it's taking. Now, of course, one of the big considerations right now is who's feeding the information in, and therefore the restrictions, limitations, censoring, some of the attitudes. We talk about wokeism and all of that stuff. That's all forming some of the models that are being developed. But equally, and this is why I don't believe in regulating it, because you've got to be able to counter-respond and develop things that may have a different viewpoint, a different narrative.
It's more about the transparency.
Transparency is everything.
So one of the topics I'm interested in, I'm actually working on deeper, is algorithmic bias.
Yes.
And especially if you look at how algorithms get biased, it's not because of the technology or AI.
Mostly feeding it in.
Mostly the person, and especially the data
Correct.
set that they're working on. So I fully agree with you that as long as we have a wide data set with different values
with extreme transparency.
Yes.
That is the key word here. But we need that for all aspects of life. And I think this is a disappointing thing. The last 4 years, have seen censorship increase. There are attempts to increase regulation. We certainly know that the World Health Organization and the United Nations have been trying to power grab, in want of a better way of putting it. I was one of the signatories on a formal letter to very eminent people. And we are, I would argue, almost regressing in some ways compared to where we were 20 years ago.
So that 20 years, the change, what you're talking about, not in 2 decades, but that has happened in 2 years or 3 years.
Yeah, correct.
Right.
Absolutely.
So I think that's where we leave, and we will continue these conversations. It's an amazing person to talk to. Niroshan Sivathasan would be on very soon on a podcast that I'm planning to actually continue on AI. So let's see you there. Thank you. Good night.